community physician in Sri Lanka who is deliberately work for the community health and public health system in Sri Lanka. So this is our very good opportunity to get his experience and implement it our future project and future actions. So let me welcome the Dr. Kapila Jayarathne.
After the lunch, you all may feel a little sleepy, but I will try my best to keep you awake all throughout. What I'm going to talk to you today is how the maternal and child health service delivery is organized in Sri Lanka with a focus to birth defects and onto club food. We started our maternal and child health service delivery way back in 1879. We were under British rule, and thanks to them, we got this Bisoisa Maternity Hospital. I think it's the first ever maternity hospital in the South Asian region. And then the main turning point of the Sri Lanka's maternal and child health is the start of this public health services. So, field maternity and child care started in 1926 as a pilot project under British rule, and then it was expanded to cover all the households in the country. That is the crucial point. We started all these programs in 1968. Family Health Bureau, where I worked for 15 years, and altogether in 27 years in the Ministry of Health. So it started in 1968. Next slide. Thanks to these global initiatives in primary healthcare in 1987, Safe Motherhood, and 2000 the Millennium Development Goals, and 2016 Sustainable Development Goals. As a country, we were targeting all these goals, and we at all the times we achieved them. And the basis of our maternal care is based on scientific evidence and continuum of care. So we adopt a life cycle approach. I mean, starting from pre-pregnancy, then pregnancy, postpartum, family planning, and then again adolescent health, well-women clinics as a cycle. So it's a life cycle approach. It's a continual care using the health system both at the home, household level and the community level. So there are referral pathways. Any person in this country, if the person is ill, they can reach to a hospital anywhere, and within 30 minutes they can receive the required health care. So that is the beauty in our system, either in the private sector or in the government sector. Within a radius of 5 kilometers, you find an MBBS qualified doctor in this country. So, our services are expanded everywhere, and the availability, accessibility, and ability. All three A's are there. So capacity wise is always who can prescribe is a qualified MBBS doctor. So no other people cannot give medications to general public. So that is the rule in this country. So that we maintain everywhere, even other categories of healthcare workers except vaccination. All other medications are given by doctors. So this is the model of Sri Lanka's maternal and child care. You see, I was talking about the life cycle approach, starting from the marriage, then care for eligible couples, then family planning, women's health, pre-pregnancy care, antenatal care, intranatal care, postnatal care, infant and child care, then again school health and adolescent youth. So it's a continuum of care throughout the life cycle. So these are just a schematic representation of the domiciliary and clinic care we provide. So we register all the pregnant women before 8 weeks of pregnancy. So then the registration coverage is 80%. Then there are steps. Can you move throughout the pregnant period and after the pregnancy period? So at the hospital there is a newborn screen. So where we pick all the birth defects including clubfoot, and then there are household home visits conducted by the public health midwife, and there are many encounters with the healthcare system. Each and every child is seen by a medical officer, and all these are spelled out in a maternal care package. All the steps, whatever is to be done by the public health staff in the field setting are outlined in this package. So we train all the relevant people with the help of a training system, in-service training package we have. Now Dr. Harita is happened to be a divisional level healthcare manager. So he was trained. The first he has the qualification, then he was trained in the National Institute of Health Sciences for 3 months, how to deliver public health care for the people. And then again, periodically we have pre-pressure programs